Hello, I'm Michelle Fox with DentistryIQ.com. This week we'll be talking about a course that will be presented at the upcoming American Association of Dental Office Managers meeting. The International Congress of Oral Implantologists encourages dentists to interact with other doctors during the education process for implantology. The public health columnist for RDH Magazine talks about how the historical progress of public health in both medicine and dentistry are similar. Finally, we tip our hat to a quick-thinking Fort Worth, Texas dental hygienist who saved the life of a driver who crashed into a dental office. The American Association of Dental Office Managers will be hosting its annual meeting this year in Nashville on September 8th through the 10th. Recently, Kevin Henry, the editor of Dental Assisting Digest, had a chance to sit down with Teresa Duncan to talk about the course she's offering at the meeting.
Well, we're calling it the Foundations of Dental Office Management, and it's going to be what we consider to be the ADOM cornerstone foundational course, because what we're finding is a lot of new office managers are coming in and they don't have, they have less than 5 years experience, and we're giving them really advanced topics, but yet they don't have the basics there. And so this was something that has come up on surveys. It's something that we've been batting around, and when Heather and Lori and Lisa, who are the head honchos over at ADOM, they were talking with me about it, and they said, how about helping us out with this? And of course, you know me and educating office managers, sure. That's what I'm all about. So we're going to go over what a new office manager should know about, what can help them out, the pitfalls they can avoid so that they don't make the same mistakes that I know I made. I mean, I've been in this for 20 years and I've made some doozies, so I want to help them avoid that too. So I'm looking forward to it.
Kevin also asked Teresa if she's seeing more dental assistants take to the front desk, or if dentists are bringing in office managers from outside the dental industry.
That's a great question, because it's a growing trend that we're seeing business people coming in and being asked to manage the office, and they either don't have dental experience, or they've had dental experience but not clinical experience, and so many times they're trying to manage a completely total aspect of the practice that they're not familiar with. Right. But we are seeing some MBAs being brought in, and the reason is in people with business degrees, because there's so many group management practices now, right. And I know you're seeing that the practices are they're blending together. It's not just the single doctor anymore. It's right. 2, 3, 4 locations, and so those need a true business manager, not just the person that answers the phones or files the claims. This is somebody who really needs to know the ins and outs of insurance, needs to know the ins and outs of human resources, and needs to know the ins and outs of leadership.
Gotcha.
And that's a big thing. So yeah, you're definitely seeing more business people coming into the field.
The upcoming ADOM meeting in Nashville is sold out, but if you want more information on the conference or the organization, you can log on to www.dentalmanagers.com from their patients by visiting periobalance.com. Kevin also recently chatted with Jennifer Berg, the North American Membership Coordinator for the ICOI, the International Congress of Oral Implantologists, about the group and the important role the interaction plays for dentists looking to further their knowledge of implants.
Talking, engaging with each other, and I will tell you something that we started probably about 20 years ago within the credentialing process was, as you wish to advance in the levels in the ICOI, and we have different levels of membership, beginning as a member, first level is fellowship, then mastership, and diplomate status. And as part of that protocol, we established what's called table clinics and poster presentations so that we could have a member sharing his case with other members. And as the newer members join, it's become such an avenue for them to ask questions and to really be mentored by other members that have been involved for 30 years, etc. Right. And not in a symposium setting with 1,000 people raising their hand and asking a question that's a elementary level, because they just won't do that. So these are other ways to do that. And even at the highest level, diplomate, we don't establish a panel and just fire questions. It's a one-on-one experience with one of our Credential Commission board members who's been involved in implant dentistry for 35 years. So you bring your 2 best cases and you have the opportunity to learn from someone who has been doing this for 35 years.
You can learn more about the ICOI and its regular slate of meetings by visiting www.icoi.org. The RDH Magazine publishes a column titled Public Health in Every Issue. Christine Nathy, a professor from the University of Mexico, is the author of the magazine's column. She wrote about similarities between public health and medicine and in dentistry. Mark Hartley, the editor of RDH, is back in our Tulsa office, and he has more details about the interview. Mark, what do you have for us?
Hello, Michelle. As you mentioned, I talked with Christine Nathy about her column for the August and September issues of RDH magazine. The columns were inspired by her reading of a book titled Historical Perspectives in Public Health and Administration. Interestingly, she drew some parallels between the early years of medicine and public health and the current status of dental public health today. And here's what she had to say during our conversation.
One of the issues kind of stemmed from the fact that physicians who were seeing preventable diseases really didn't have a voice in America at the time. A lot of them were trained really in a proprietary nature with other physicians, and there wasn't accredited medical schools like there are now, and they really lacked a voice. So when there were issues that they were seeing that were affecting a lot of people, they weren't able to really get society to make changes to address these issues. And I thought that that was very similar in what we kind of see in dental care right now, because in dental hygiene, what I've noticed since I've been a dental hygienist is that dental hygiene has been progressing not just in science and practice, but also in the value that people have towards dental hygiene and making sure that they're getting their teeth cleaned and asking their dental hygienist about, a specific product that they may be interested in trying. And so I feel that we've been progressing quite a bit, and with that progression, we've had such a progression in the education of dental hygienists, more dental hygienists obtaining baccalaureate degrees, and of course the abundance now, or almost abundance, of master's programs in dental hygiene. So we've really seen the education increase.
Christine, of course, uses the comparison to warn the dental hygiene profession about the opening of some dental hygiene schools in recent years. She advocates programs that encourage hygienists to obtain as much education as possible.
What's happened though in the last few years is we've had the opening of a lot of proprietary schools that the courses that dental hygienists are taking in these schools are not always transferable to universities that have Bachelor of Science and Dental Hygiene degree completion programs. So I think as a profession, we need to continue to work to advance our education and do what it takes to make sure that most dental hygienists have the opportunity. Really, I would like to see all dental hygienists have the opportunity to get their bachelor's degree and, Bachelor of Science and Dental Hygiene programs, as well as master's, and hopefully up to a doctorate sooner than later.
Thank you for that, Mark. On Monday, August 29th, Julie Watson reported to work at Dr. Gary Pointer's dental office in Fort Worth, Texas. Not long after arriving, a car crashed into the dental office. Bystanders pulled the driver out of the car, and Watson shocked him once with a defibrillator and then started CPR. As you can see in these photos, the car damaged the dental hygiene operatories. The driver was taken to a local hospital where he was reported to be in fair condition after the on-the-spot emergency treatment, which was initiated after no pulse was detected. Watson told Fort Worth Star-Telegram, "I'm usually not good under pressure, but luckily I held it together today." Her bravery was applauded by the Fort Worth newspaper as well as ABC affiliate and DFW Metroplex. We too would like to thank Julie for her poise under pressure to save a life. And thank you for joining us on DentistryIQ.com. I'm Michelle Fox saying goodbye until next week.